Okay, I have 1:15 on my clock, so we'll go ahead and get going. Welcome everybody to our weekly news media briefing regarding all things COVID-19 with the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for IU. We'll begin with our opening statements. First of all, with Bloomington Mayor John Hamilton.
Thank you, Chuck. I don't know if they're going to compare your statement of now versus 2 years ago. You're getting really quick and you've got this all down so solid, man. Well done. Thank you. Good to be with you all. I hope we seek improvements continuing. I'll give the quick city update on specific data. We had 9 positive cases in our workforce in the past week. That was down from weekly numbers above 30. And of course, 102 I reported in the month of January. So we're very pleased to see that reduction. We are continuing our incentive programs for vaccines and our regular testing of unvaccinated employees. We identified several positive cases that way. We've seen some improvements in vaccine numbers as of today. The percent of all active employees, including temporaries who are vaccinated, is 75%, which is up from 70% 3 weeks ago and 66% 5 weeks ago. So we're pleased to see that growth. And if we just look at all regular active employees, not counting temporaries, that is also a 75% demonstrated vaccination rate, up from 71% 3 weeks ago and 69% 5 weeks ago. We're pleased with that. I give you the utility sewer numbers. They had been increasing dramatically, but this week at Blucher Pool, we were at 180 parts per 100 milliliters. That compared to 1,200 2 weeks ago, and over 3,000 some weeks past. So that's much better. And at Dillman, the south side, we were at 4,800 3 weeks ago, 770 2 weeks ago, and this week we were at 30. So those are really big numbers. Again, we know they're one little data point. There may have been a little dilution from snowmelt in that, but from what we know, nothing like that dilution would explain that very dramatic drop in the identified variant COVID RNA samples in the wastewater. So that's good. We hope that's an early indicator of the prevalence of the virus here. So we know we have some positives compared to the past few weeks, which is very welcome. We can be hopeful, we need to be, but we also know we're still at a very high rate of infection relatively. There's still high rates of death in the state and nationally. It's still really important to keep encouraging vaccinations. We're glad to see that growing in our workforce. Especially important, I think, to keep reminding those who are vaccinated to get boosted. The number of boosted is far lower than the rate of vaccinations, and really important. I think I'll let other experts mention that directly. And we know the state is still virtually all in red in the indicators. We're glad to see numbers coming down. We hope that we are coming out of the Omicron, but I do also hope we can keep steady and keep doing what we're doing that is working, and hope we don't get surprised by anything else around the corner. So glad to share that data with you, and happy to answer questions. Thanks, Chuck.
Okay, let's next check in with the Monroe County Department of Health and Penny Caudill.
Good afternoon. I am going to mention a study in a minute, and I've already put the link to that study in the chat. We do remain red advisory this week with high transmission, but there are glimmers of hope, as the mayor talked about, and we continue to see improvements across the county and the state. The decline was starting before last week, before our snowstorms, but it is expected to continue. Omicron has shown these steep, fast surges followed by steady declines, which is what's currently being watched. The Indiana surge started in northern part of the state, and that's really where we're seeing the biggest improvements at the moment. Some of those counties are seeing a decrease by 90% since the Omicron peak. Positivity trends do remain high, but are also improving. County positivity rates across the state range from over 30% to under 20, with everybody being over 15, I believe. I don't know of anybody under 15% at the moment. Our current weekly positivity rate stands at 19.72%. Our daily average of cases is also declining. So all good pieces of information, all good indicators, but we know that no single piece of data tells us the full story. So it's also important to look at those hospitalizations, opportunities for treatments, vaccine and testing opportunities, or vaccination rates, and any other available data. Even the water data that you mentioned, the sewer data, is good additional data for us to have. This week, the CDC's MMWR included a recent study regarding the effectiveness of masks. People who reported always wearing a mask in indoor public settings were less likely to test positive for COVID-19 than people who didn't. A cloth mask wearer reduced their risk by 56%, a surgical mask by 66%, and a KN95 or N95 by 83%. Now remember that wearing a mask correctly is key, and even a cloth mask, if you have multiple layers, maybe a filter, heavier material, you're going to get better filtration than if you have a very thin one layer mask. And no mask is better than how you wear it. So if it's on your chin, it doesn't matter if you've got an N95, if you're wearing it on your chin, it's not going to give you the protection that it could. So check out the article in the link that I provided. So what are the takeaways today? Transmission is still high in Monroe County and in Indiana. Masks do reduce the infection and transmission rates. The data is holding true for Omicron and how it rises and falls, and we're optimistic that we are coming out of this surge. We're not out of it yet, but we are optimistic. Vaccination is still our best tool to end this pandemic and reduce the risk of future surges. Continuing to use all of our prevention tools will allow us to move forward in the safest way. The current local regulation remains in place until the executive order expires. The Board of Health will meet again on March 3rd to approve any future recommendations and to assess where we are at that time. Thank you, Chuck.
Okay, let's next check in with Penny Givens and the Monroe County Board of Commissioners. Sorry, I was trying to find you on my screen.
Thank you, Chuck. I think I just want to repeat what Penny Caudill said, that like the Super Bowl organizers, Monroe County still has a mask requirement in place. I thought that was interesting that Super Bowl is requiring that for attendees. We have more blood drives scheduled on Tuesday, March the 29th from 10 to 3, and on Wednesday, March 30th from 1 to 6 at IB Tech. I'd like to remind everyone that you can give as often as every 8 weeks, and every unit of blood can save up to 3 lives, and there's still a great need in this area. We still have money available for those who need help with their rent or their utilities through our township trustees. We have provided additional money to help keep people housed and safe. And lastly, I just want to thank all of the healthcare workers, especially through our hospitals in Monroe County, and everyone who's doing their utmost working to rid our area of COVID. Thank you.
Okay, so let's go to IU Health and Brian Shockney.
Thank you all. Thank you all for being here. Good afternoon, and we're optimistic about this week's COVID-19 inpatient numbers, and we continue to keep a close eye on our census across IU Health South Central region. However, as our numbers of inpatients currently on isolation for COVID go down, we're still seeing a larger volume of patients in this surge as you can see here, that are requiring a longer length of stay. So patients go off of our isolation list after a certain number of days, but these patients are sicker than our previous surges, and so they are coming out of the hospital and having longer lengths of stay and coming out of the hospital at a longer period of time. So that's continuing to, while we're seeing the numbers start to come down this past week, it's still not reducing the number of beds we need here in our hospitals in the South Central region yet. We are hopeful that that will happen soon. So as we look at our COVID-19 admissions since the pandemic began, this has been a sustained surge, but we're continuing to come off of the second highest census we've had experienced through the pandemic. This pandemic continues to affect the number of patients visiting our emergency departments. So I'm going to put the call out again. We have some very busy days. So if you have COVID-like symptoms and you do not have emergent symptoms, we do have our urgent cares. We've stood up our walk-in centers that have seen 16,000 patients in 2 months. We would really like you to utilize the graphic that we've put out on our social media and that you see here that can help you decide when to utilize the emergency rooms and when to utilize other services. By choosing the level of care that best suits your healthcare need, you can help by ensuring that the emergency department beds are reserved for those who truly are in an emergent state. I do want to talk a little bit about the deaths, as this has been very high. The New York Times reported earlier this week that over 21,800 Hoosiers have died from COVID-19. And we know from last week's Wish TV report, there were an additional 800 plus deaths that were COVID-19 was probable, but we didn't register them as such here in Indiana. This is why we continue to ask the public to get vaccinated. We're asking because it's free vaccine and it will make the difference between recovery and very poor outcomes for people who are infected with COVID-19. We say this every week, and the principles remain the same. Wear a mask, clean your hands regularly, and get fully vaccinated. This is still while we're coming down off of this surge, the levels are still as high as we've seen them throughout the pandemic. We're still a lot of red in Indiana. And so we can't get complacent because we're going down the hill. Sometimes as those who ski, sometimes when you're going down the hill, it's pretty dangerous. Going up on the lift isn't so dangerous. We continue to focus on our ability to perform surgeries at our IU Health facilities. Even though we had the high census, we've been able to increase our surgery volume in the last couple of weeks with our focus on endoscopies, which are the mostly outpatient procedures, and shift some staff to that area. We do continue to triage surgeries that require an inpatient bed on a daily basis and are beginning to perform those. Actually, next week, we will have a higher number of inpatient surgeries scheduled for Monday. Given we don't see any additional surge, we'll be able to start doing more of those on Monday of next week. Just a reminder, hundreds of patients are backlogged for elective surgeries given the latest surge, and it's been 2 months since IU Health Bloomington opened the surgery schedule outside of emergent and highly urgent surgeries. So we will continue our focus on this work. We triage these daily, but it's going to take some time. We also remain very hopeful that we do not experience additional surges and that we could impact our needs, and we would be able to continue to ramp up these surgeries over the next coming weeks to be fully at capacity. As many of you know, we have not been able to use this new IU Health Bloomington Hospital to its full capacity since we moved in. And so we are really anxious to get back to that and get out of this COVID surge. Lastly, we are so very appreciative of our patients and their patience in waiting for their procedures to be rescheduled. Some have been rescheduled 3 times. These are difficult times, and our team certainly appreciates the words of kindness and support from those who are coming in and getting and expressing their understanding of getting their surgeries and procedures now. Happy to take questions at the end. Thanks, Chuck.
Okay, this next check-in at Indiana University, Aaron, Carroll, and Kirk White.
Yeah, thanks everyone for being here. We're seeing very much the same as what everyone else is reporting. Our cases have dramatically declined. The numbers posted on the dashboard this week are significantly less than 10%, I think, of what they were just a week or 2 ago. Our positivity rate as well has plummeted. We are back into the low single digits. after we were, up as high as the rest of Indiana. Because of this, we are ending some of our explicit sort of Omicron extra guidance on campus and reverting much to what we looked like in the fall, because the numbers are returning to those levels once again. We're still not seeing really anything that would lead us to believe that there's classroom transmission. We're still doing contact tracing and our usual quarantine and isolation. In fact, with these low numbers, we have completely caught up again to our queue, and our large team of contact tracers is reaching everybody very quickly. We still are doing a fair amount of testing. We will continue to do that. Most of it is symptomatic, although it has certainly decreased quite a bit from the high point of the surge. This is seen across the board in all the numbers that we're seeing. Even our sort of in-house isolation, last I checked, was down to 1 student who might be going home today, in which case we would be empty once again. So we're optimistic that things will continue to improve. Of course, like everyone, we'll be watching the numbers both in the community and the state, and worrying about potential variants in the future. We're still encouraging vaccination and boostering. In fact, our incentive program for students kicked off today, where if students voluntarily upload their booster information, then they receive $20 in Crimson Cash. So we'll be talking about that more. We'll be pushing that out, trying to get as many students boosted as possible, trying to get everybody boosted if we can, which is certainly going to be the best protection we have against future surges if and when they come. And happy to take any questions.
Well, thank you, Dr. Carroll. And just a few specifics for the Bloomington campus. Yes, our numbers are down in a pronounced way, just like everyone else. This week, we're reporting just 69 cases for the week that ended with our reporting period on Wednesday. That's an amazing drop. You remember last week, we were at 385. So just 69 cases this week, 50 of those students, and the other 19 were faculty and staff. And that's enabled us to get a lot of our services recovered on the campus that were curtailed in different places with much lower infection rate among our faculty, staff, and our students, who many of our students are part-time workers as well. So this has been a big help. Our vaccination rate remains at 95%. And as Dr. Carroll mentioned, we're ready to roll out the booster incentive program. This is for students. It will be a $20 credit on their Crimson Card account. And I'll give you the link with more details, but basically students will need to upload a copy of their or a picture or scan an image of their vaccine card that shows that they did get the booster. That will help us process that $20 credit. And if a student needs a booster, of course, we've got plenty of opportunities in the community, and our Student Health Center still is offering boosters. So just make an appointment and drop by the health center. You can get your booster and then be eligible for the $20 incentive. So that's our update for today. Good news.
Okay, we will get into questions. First of all, from Dave Askins, the B-Square Bulletin, for Commissioner Givens and Mayor Hamilton. At the Board of Elections meeting on Thursday, the point was made that there's no need to wait for the governor to do anything in order for us locally to launch the start of hybrid video in-person meetings. And apparently Bloomington and Monroe County are the only places in Indiana where public meetings are still being held just on Zoom. Why not celebrate Valentine's Day next week by launching hybrid meetings? That's traditional, by the way, for the county board of commissioners or the city's board of public works.
Well, we know that our borders are porous. We can't stop people at our borders. We feel like if we could, that we would be even healthier here in Monroe County. We are trying to follow the advice of our health department with this mask mandate. And we feel that partly that, and also all the cooperation we have gotten from the folks at Indiana University have made a big, big difference in our community. And other communities where they have large student populations, they're not faring as well. And so we feel that this is still an important part of preventing the spread of COVID. And I think that Ms. Caudill pointed that out earlier, that we have some studies now that support the use of masks. So we're going to continue with this at least through the end of this month.
Thanks. I'll just add that I love the fact that you think somebody might want for Valentine's Day to go to a public meeting. I think that's awesome. And I don't know if I recommend it, but seriously, we look, as Commissioner Giddens said, Monroe County has not really taken the advice of, hey, if everybody else is doing it, you should do it too. I think we've tried to follow the science. I think it's really helped us. We've had an extraordinary collaborative approach to try to minimize risk, and we're really proud of what we've done together on that. That being said, I do think we are likely to see movement into in-person meetings happening more. I don't think those will happen next week that you mentioned, but since you offered the teaser, I'll throw out, I do think on February 24th, which is 2 weeks from yesterday, there will be a State of the City meeting, which is technically a city council meeting, which probably will be hybrid. That's our current plan to have at the bus Kirk Chumley, which you may know also requires vaccination demonstration and spacing and masking. There won't be any food, so it really does control a lot of the other risks that still are there, as we're in hundreds of cases a week still. So, but I think we're headed in the right direction, but not for Valentine's Day. I can probably report now.
Maybe in time for St. Patrick's then. So for Brian Shockney, this is again from Dave Askins. He says, I didn't quite understand the chart that showed the number of patients compared to the number in isolation. Could you walk us through that one one more time and why it's significant?
Yeah, thank you for asking. So as you can see in the beginning of this chart, for the most part, those two lines are very close. The orange line is the total number of patients who were admitted, primary diagnosis of COVID. They came into our hospital and had to be admitted because they were sick with COVID. Enough to be admitted. The blue line is the number of patients who are currently isolated. So those are patients who are active COVID patients, those that require, they're not past their date of positivity. So they don't need to be in an isolation room. They were maintained, they may still have oxygen, they may still be on ventilators, those kind of things, but they're not contagious. They've been through that period. And what we've seen in this last surge, as you see on the right half of this graph, is those lines started separating, where patients who were coming in, they would go off of the COVID isolation number, but they're remaining in the hospital. And you see how that's a flatter line, that orange line. They're remaining in a hospital bed and requiring high level of support for their care. So when we look at starting back surgeries and being able to have staff that can be at the bedside doing other things, it requires that our staff and our resources still be caring for those who are inpatients and who are fighting this virus, because they're remaining in the beds in our facilities and in beds that are meant for surgery patients checking in and checking out. So we put it up this week because we wanted to ensure that people understood that just because the numbers are going down doesn't mean that patients are still not very sick and in the hospital and continuing to be in a hospital bed in hospitals around the state and country where they need that supportive care. They're still too sick to go home, but they're not considered contagious and in isolation for COVID. So there are two different numbers that we report. I hope that helped.
Okay. Next question from Patrick McGurr at the HT for Penny Caudill. When it comes to making decisions to extend the health order, is the county still looking at the same sort of criteria and metrics as you have for previous continuations?
Yeah, good question, Patrick. At last night's board meeting, there was a lot of discussion about the changes and how where we are now looks very different from the fall when these metrics were put into place. And as we've talked about all along, you've got to look at the big picture. So currently, the Board of Health is not looking to extend the health order beyond the parameters of the executive order. So right now, our current health order is in place, the regulation is in place, and it falls under the authority given through the governor's executive order. Once that executive order expires, which is set to expire March 4th at this time, then our health order would also expire. So right now, that is the expectation. They are meeting on the 3rd so that they can do a last look at where we are, and they can look at if it looks like the governor is going to extend that order. Do they want to continue with that, or do they not want to do that? So that's kind of where they are. They're not looking really at those same metrics, and they're just trying to look forward in terms of where we are. And hopefully those numbers, the downward trend that we're seeing, will continue and things will be even better, and it will make more sense to let that expire at that time. The board is very serious about wanting to make sure that they express their recommendations, that those will not go away. We know all the things we've talked about vaccinations and masking and, assessing your own personal risk and those kinds of things are still very important. They're going to continue to be important. So we will be working on drafting recommendations so that we can share those whenever the local health regulation ends. Hope that answered the question.
Okay. Next question from Clayton Young for Aaron Carroll. When you said that there was a low risk for in-classroom transmission, where was that data from?
Well, every day since the beginning of the pandemic, we have an outbreak investigation team that meets every morning. And we talk with the contact tracers and their managers about tracking down every single case, close contacts, and talking to them about where they might have got it. This allows us also to see when there are what we might call outbreaks, when multiple transmissions might have occurred. Almost none are ever linked to classrooms. I mean, when we find evidence of where we think transmissions came from, the vast majority are household transmission. A fair amount occur in large gatherings or parties, weddings, going to bars, sometimes restaurants, parties, but really very little evidence that anything has been transmitted in a classroom. In addition, again, we're universally masked in classrooms. We have not even been, we've been asking professors not even to remove their masks during the surge, or to anyone to eat and drink, so that there's no removing of masks in classrooms. On top of that, we did studies last year where we looked at the number of in-person class hours that students might have had and its relationship to how likely someone was to have gotten COVID. And what we found was that the more in-person class hours that one had, the less likely they were to get COVID. I can come up with a number of reasons why that might be. It could be the type of student who takes more in-person class hours is less likely, but it also could be that, again, being in class is some of the safest time that people spend. It's very regulated. People are sitting, they're not mingling, they're masked. It's just not the danger for the vast majority of our constituents. So some of that is looking at past data and class hours in general, but a lot of it is also just very much that we do the detail retail work of trying to figure out where each person who gets COVID got it.
Okay. Another question from Patrick McGurr at the HT. This is thrown out to anyone and everyone. Is there a need for care or caution in public health messaging regarding masking? Some people may be reluctant to return to mask wearing during future surges, for lack of a better term, he says. So who wants to take that one on first? Penny?
Yeah, I'll start. Certainly, we continue to look at messaging and how we can improve it. I'll go back to the recommendations that the board wants to make sure that we have in place so that we are very clear about what measures people need to take. And we will continue if we have additional surges or numbers appear. We don't want to wait until we're in a surge. If numbers appear to be going up, even with no additional regulations, we can get messaging out to people to let them know that they may want to consider various prevention strategies. And I've said this before, and I think it's true. I think we will see more people wearing masks at various times than we've ever seen before. It's not been the culture in the United States to wear masks a lot, but I think people have, I know people that have reported, I've had less allergies, I've not had colds, I've not had the flu. Even if I didn't get the vaccine, I still didn't get influenza, and that they fully intend to continue to wear masks at various times. So I think we will see more of that.
Okay, Aaron, yeah.
So I think it's a good question. I think there are two schools of thought about this. One is that, some people fear that if we lift any restrictions, it'll be very hard to get them back, so that we should hold on to things as long as possible. The other school of thought is if we don't give people a break and we don't actually respect that when things get better, we're going to pull back, then they'll be less likely to advance again in the future because they won't believe us when we say we'll pull it back again. I tend to favor the latter, but that's an opinion. We are in new territory here, and we're dealing with, thoughts and procedures that just have not been enacted before. But I've been heartened by how much our community has done when asked, that I believe if we treat them fairly and we acknowledge when things get better, that in the future, if things got bad again, they would do what is necessary to protect each other. And I do get concerned that if we continue to, I won't say punish, but if we continue to tell people who have done everything we've asked them to do to continue to do it because we don't trust in the future they'll do it again, that doesn't ring well. And so I think that we're going to probably see more and more locations around the country, not even perhaps locally, really reducing some of the restrictions in the next few weeks if things continue to improve, because we're going to need to be able to have a breather in case we have to ratchet back up again.
Yeah,
I might just add to the two health professionals you just heard from, a non-health professional, the viewpoint that agrees, what we can do to depoliticize masking is helpful, and just reminding people this is based on the data and trying to keep people safe. And I do think dialing the thermostat based on the science is right. I think, for all of us who have been in different places, even in the last few weeks or months, feeling such different approaches, it's kind of dramatic. And I do really appreciate that our community, I think, can and will deal with the adjustments. And I know our school systems, for example, are sensitive about this. And I think continuing to just try to stay calm and breathe deeply in our own spaces safely, breathe deeply and follow the science is the right thing. And I appreciate the way folks are urging that so much here. Thanks.
Okay. Don't have any other questions at the moment. I'll hang on just a moment in case someone wants to get one last one in. And so we'll put in a plug for our own IU information page again, at covid.iu.edu, where you can find more information. Also put in a plug for our weekly webinars with our own Aaron Carroll, which is every Wednesday, but you can watch those broadcast on archive at broadcast.iu.edu. And there is a link on that covid.iu.edu page, and they are informational and informative. And I think that they are a wealth of you can learn about the issues that we're all facing right now. So seeing no more questions, we will go ahead and leave it there and wish you all a good weekend.